Hi, Tiara. I'm Tara. I'm going to be your student nurse practitioner today. How are you?
Good, how are you?
I'm doing good. Well, today you're here because we're going to do a head to toe assessment. That means I'm going to be checking and assessing everything from your hair all the way down to your toes. Is that okay with you?
Yes.
Okay. So to get started, I'm going to sanitize my hands and I'm just going to ask you to tell me your name and today's date and where you are.
My name is Tiara. I'm in a doctor's office, and today's date is April 25th.
Okay. And can you tell me who's the president
Joe Biden.
and the current season we're in right now?
Spring.
Okay. All right. So now I'm going to start off with the exam. I'm going to be assessing your skin, hair, and nails. So the first thing I'm going to do is inspect your skin. So what I'm going to do is take a look at your skin, look at your arms, the skin on your arms and your legs. Make sure the color is symmetrical. Your color is even tone all over. I'm also going to be looking at your skin for any scars, bruises, lesions, or birthmarks. I notice you do have a few tattoos. Have a tattoo on your leg, on your arm. You have a couple of moles on your arm, and I see a mole on your face. Any other tattoos?
I do have one behind my ear,
Okay.
and I have one on my side here.
Okay. I'm gonna just look at your skin all over, back. Make sure your back doesn't have any scars or bruises. Any up here on your shoulder or chest area?
No.
Okay, I see you do have a navel ring. Okay, so now I'm gonna palpate your skin. When I palpate your skin, I'm just checking for the warmness, the temperature. I'm also looking for moisture, making sure there's no diaphoresis. And your temperature is normal, your skin is smooth, and the texture is smooth. And now I'm going to check your hair. So when I inspect your hair, I'm just going to be looking at the color, the texture, and your hair distribution. Texture, I'm going to palpate. Texture is normal for your ethnicity. Length is bra strap length. Your hair distribution, I'm going to look around your edges, make sure there's no like receding hairline or any alopecia or like balding spots. None in the back. Next, I'm going to check your skin or your nails. I'm sorry. I'm going to look at your nails. I'm going to check the shape of your nails, the color of your nails. The nails are checking your hygiene and your cleanliness. Your nails are short and round. I'm also going to check your capillary refill, and it is less than 2 seconds. I'm going to check on this hand as well. Your nails are round. There's no divots or cuts or dry cracks. No hangnails noted. I'm also going to check your toenails and make sure the nails are round, short. Temperature of your feet are warm, just like the rest of your skin. Color is also the same. Capillary refill in your toes is less than 2 seconds as well. And there's no swelling in your feet while you're sitting. I'm going to leave your socks off for the next part of the exam. So I checked your skin, your nails, and now I'm going to check your scalp. I checked your hair. I'm going to check your scalp. When I feel for your scalp, I'm just checking the shape of it, making sure there's no indentations or no dents or any deformities. I'm also going to look at your scalp, make sure it's clean and dry, no dandruff, no ticks or lice or bugs or anything like that. Okay. Okay. Next, I'm going to check your face. I'm going to look at the symmetry of your face. Your eyes are equal as far as being far apart. They're not too close to your nose, not far apart from your nose. Your eyebrows are symmetrical in shape. Your nose is uniform. It's midline. There's no deviations in it. Your lips are round and symmetrical. And the shape of your face is kind of like a pear shape. And it's even around. I'm also going to pull your hair back so I can get a good look at your ears. Make sure they're symmetrical as well. And then I'm going to move on to your neck. So I'm going to assess your neck. First, I'm just going to look at your neck, make sure there's no swelling, no extra skin folds. And I'm also going to palpate for any tenderness or any masses. Also checking for any like crepitus or anything like that. No tenderness or anything when I do that. Okay, I'm also going to check your range of motion in your neck. Can you rotate your head in a circle for me? Good. No pain or tenderness when you do that?
No.
Okay. The next thing I'm going to assess is your lymph nodes. So for your lymph nodes, there's 10 spots there, 10 locations that I'm going to be assessing. The first one is your preauricle. It's at the front of your ears, your postauricle behind your ears, and then your occipital. That's at the base of your skull. And then I'm going to check for your sternocleidomastoid, and then your submandibular, and then your submental, your anterior cervical lymph nodes, your posterior cervical lymph nodes, and then your supraclavicular lymph nodes. And I don't feel any. If they were firm or anything like that, that would be of concern, but I don't feel them. The next thing I'm going to assess for is your eyes. I'm going to get while you're sitting here, I'm going to test your trochlear mandibular, your TMJ joint. So I'm going to put my hands right here and ask you to squeeze your jaw. Okay, now I'm opening it up and down. Good, no pain, no popping, and no crepitus felt when I assessed her TMJ. The next thing I'm going to do while I still have you sitting here in your neck, I'm going to check your thyroid and your trachea. So your trachea, I'm just going to assess here and make sure it's midline. And it's midline. I'm going to check for any tugging. Swallow for me. I don't feel any tugging or pulling. And then I'm going to check your thyroid. I'm going to assess from the behind you. I'm going to just place my fingers on your thyroid. I'm checking for any swelling, tenderness, any nodules. No pain when I palpate?
No.
Okay, swallow for me. Okay, and everything feels normal there. And then I'm going to grab my stethoscope because I'm going to auscultate your thyroid. I'm listening for any bruise. When I do this, I'm going to use the bell of my stethoscope. I'm also going to listen to your temporal artery. I'm listening for any bruise. And then I'm going to listen over your eye. Close your eye for me. And I did not hear any bruise in either of those, in your temporal, your eye, or your thyroid. Okay. For your face, I did forget to palpate. I'm going to do your maxillary sinuses. Your maxillary is down here, and then your frontal sinuses. Any pain or tenderness?
No.
Okay. All right, so now I'm going to move on to the eye assessment. I'll grab my otoscope and get that ready. So the first test we're going to do. All right, so now that I have my Snellen chart, we're going to test your visual acuity. And then the next thing we're going to do is check your peripheral vision. So I'm going to scoot back at least 3 feet from you, 4 feet from you, and I want you to read the last, whatever line you can read on the chart. Can you read the last line for me? Cover one of your eyes for me.
LTFPH.
Good. Now switch your other eye.
LTFPH.
Okay. And that means you have 20/20 vision. And then I'm going to check your peripheral vision. And then I'm gonna cover one eye, and I'm gonna have you tell me when you can see my hand come into vision.
I see.
Okay. And then up top.
I see.
Okay. I'm gonna do your other eye. And tell me when you can see my hands.
I see.
Okay. And then up top.
I see.
Okay. So now I'm just gonna look at your eyes. Already assessed your eyebrows for symmetry. They look normal. I'm gonna look at your eyelids, look at the hair distribution out of your eyelids. I'm also gonna look at your conjunctiva. I'm gonna pull your eyelids down. I'm looking for any drainage, discharge, any foreign bodies, any erythema. I don't see any of that in your conjunctiva. Your sclera is normal color. I don't see any jaundice of the eyes. Now I'm going to grab my ophthalmoscope, my light, and I'm going to check your pupils for perla. So let's turn it on. Your eyelids also, I don't see any drooping or sagging or anything like that. And I'm going to have you look straight ahead at an object far out. And I'm going to check your pupils for pupil size and see whether they dilate in the light. Good. And we'll do your other one. Good with constriction. I notice both of them constrict when you put light on them. Your pupil size is about 2. And then I'm going to check for accommodation. So I'm going to have you put your hand right here in the middle of between your eyes. And I'm checking for accommodation. I'm making sure both eyes or both pupils constrict. Yes, and that eye constricted, her left eye constricted. And I'm going to do it from this side. Yes, and both pupils constricted. Thank you. And I'll change to my otoscope. The next thing I'm gonna have you do is the 6 cardinal field gaze. So I'm gonna have you look at I'm gonna have you look at this pin in my hand. I'm gonna have you follow with your eyes, but don't move your head, okay?
Mm-hmm.
So that way. Okay, good. And the cardinal gaze field also checks cranial nerves 3, 4, and 6, and the perla. Doing the perla and accommodation also covers cranial nerves 3, 4, and 6. Lets us know those are intact. While I'm still doing your eyes, I'm going to look at your lacrimal glands and make sure they're normal in size and they're symmetrical and no redness noted. The next thing I'm going to do is change to my otoscope or ophthalmoscope, and I'm going to look at the inside of your eye. Let me turn this on. And I'm going to be looking at your lens, checking the red reflex, looking at the back of your eye, looking at your blood vessels, and also looking at your macula. So I have you look straight ahead. Take my glasses to do this. And I'm just checking for the red reflex. And I do see that. And then I'm going to look in the back of your eye at your blood vessels. Okay, I see the optic disc. And I see the blood vessels and arteries. And I also see the macula. I'm going to have you look straight at me for the macula. Look straight into the light. Okay. And I'm going to do your other eye as well. Okay, just look straight ahead. The red reflex is present. And I can see the back of her eye. I can see the blood vessels and the optic disc. Now I'm having you look straight at the light. And when I do that, I'm looking at her macula. I can see that as well. And everything looks normal there. Turn the light off. Switch my. Okay. Next, we're going to move on to your ears. I'm going to pull your hair back. I'm going to be looking at your ears. I'm going to inspect them first. I'm just going to be looking at the shape, the size, looking at your lobe, your auricle. I see you have 3 piercing holes in your ear. Any pain or tenderness when I palpate?
No.
Okay. Now I'm going to use my otoscope to look inside your ear. And I'm going to pull your ear up and back to look inside. And when I look inside, I'm making sure I don't see any foreign objects, any like excessive amount of wax. And I'm visualizing your tympanic membrane, and it looks normal, like a clear, pale white color. Any ear pain?
No.
Okay, and I'm gonna check your other ear. I'm checking the symmetry, the shape. You also have 3 holes over here. Any pain or tenderness with that one? Okay, I'm gonna pull up and back as I look in. Making sure I don't see any foreign bodies. No extra amount of earwax. I can see the tympanic membrane as well, and everything looks normal. No redness. And no ear pain in that ear either?
No.
Okay. Now I'm going to assess your hearing. And we can assume that your hearing is intact. You've been answering all my questions correctly. So the next thing I'm going to do is the whisper test. I'm going to have you cover this ear. I'm going to whisper a word and have you repeat after me.
Popcorn.
Yes. And then do your other one.
Pizza.
Yes. So now I'm going to do the Weber test. I'm going to use my tuning fork. And you're going to tell me whether you feel the vibration equally distributed or if you feel it in one spot.
Equally.
Okay. Now I'm going to do the Rhine test, and I'm going to put it on the back of your ear and up against your ear. You're going to tell me whether you still hear it or not. Okay. Feel it?
Yeah.
Can you still hear it?
Yes.
Feel it?
Yeah.
Can you still hear it?
Yes.
And then tell me, is it louder? Which one is it louder, 1 or 2?
1.
Oh, this thing, I can't never do it. So 1 or 2?
1.
And we did the whisper test that also covers cranial nerve 8, the acoustic. So now I'm going to inspect your nose. I'm just going to look at the shape of your nose. I did that. There's no, it's midline. There's no deviations. I do notice you have a nostril piercing. Now I'm going to take a look inside your nose. I'm going to just assess here, making sure I don't see any redness or swelling. Any tenderness when I do that?
No.
Do you have any postnasal drainage?
No.
Okay. And your nostrils look normal. There was no redness or swelling. I'm also going to test your cranial nerve 1. We're going to do our smell test right now. So I'm going to have you occlude one of your nostrils, and I'm going to have you tell me what you can smell.
Like pears.
Yep, let's do your other one.
The same pears.
Okay, perfect. And I already assessed your maxillary sinus and you didn't have any tenderness or pain with that. Next, we're going to move on to your mouth. I'm just going to look at your mouth. I'm going to be inspecting your lips. They're pink, no signs of like discoloration. They're not cracked or dry. I'm gonna turn my light on because I'm gonna look in your inside of your mouth. Have you open up wide? Now I'm looking at your soft palate, hard palate, your cheeks. I'm looking to see if you have any dental caries. Move your tongue back. Everything looks normal, no missing teeth. Stick your tongue out and say ah. Okay, I can visualize your tonsils, your uvula moved up and it is midline. Okay. Your gums were pink. I didn't see any swelling or no pain in your mouth, no ulcerations or anything like that. Okay. Next, I'm going to move on to your chest and your lungs. So the first thing I'm going to do is I'm going to inspect your chest. I'm looking at your AP diameter. I'm going to measure your AP diameter to your lateral diameter. Your AP diameter is about half your lateral diameter. So your AP diameter or lateral diameter is 2-to-1, or AP is 2-to-1. Next, I'm going to palpate the chest. I'm just checking for any lumps or masses, any tenderness, any crepitus. And no pain or tenderness when I do that?
No.
Okay. No pain or tenderness in the back?
No.
Okay. Now I'm gonna percuss your back. Or actually, I'm gonna do thoracic expansion first. So I'm gonna have you kind of turn that way so your back is facing me. And then I'm gonna put my hands on the lower part of your, where probably like the 10th or 11th rib, and I'm gonna have you take a deep breath in. Good. I'm checking to make sure, and you can let it out. And my hands are moving with expansion. Do it again. Good. And that has normal expansion. My hands are moving at the same time when she takes that deep breath, that expansion. Now I'm going to do tactile fermentus. I'm going to have you say 99. Everywhere I touch your shoulder, you're going to just repeat 99, okay?
99. 99. 99. 99.
And turn back facing the camera. I'm going to do it again, and you're going to repeat 99 again.
99. 99. Okay.
And lift your arms.
99.
Tactile fermentus is intact. Next thing I'm going to do is listen to your lung sounds. Let me get my stethoscope. I'm going to assess your lung sounds using the diaphragm of my stethoscope. I'm going to listen anteriorly first and then posteriorly. I'm going to listen at the apex of the lung. Deep breath for me. So every time I place my stethoscope, I want you to take a deep breath. So deep breath. Okay. I'm going to listen over your trachea area. Again. Okay. These are more bronchovesicular. It was bronchial up top. And then I'm going to listen under here. Lift your arm for me. And those are more vesicular. We'll listen to the lungs sounds in the back. Deep breath for me. Again. More vesicular lung sounds in the bases. Your right lobe, I'm gonna have you to listen more better. I'm gonna have you lift your arm, take a deep breath for me. Good. because the right lobe has 3 lungs, so that way I can listen to that third lobe better. Now I'm going to measure your diaphragmatic excursion. So I'm going to have you lay back or actually you just stay sitting like that. I'm going to percuss first and then I'm going to measure your diaphragmatic excursion. So I'm going to percuss here. Lift your arms for me. Now I'm going to percuss in the back. And all sounds like tympani sound. Now I'm going to measure your diaphragmatic excursion. I'm going to have you face that way with your back towards me. Move your hair out the way. I am going to get my measuring tape ready and my marker. Now I'm going to ask you, I'm going to mark my spot first. I'm going to measure from a place of tympani till I get to dullness. And then I'm going to mark my spot. Actually, I'm going to do this side first. All right, I'm going to have you take a deep breath for me. Hold it. Okay, let it out. I'm going to mark here. And then you're going to take another deep breath. Let it out. Now hold it when you let it out. Okay. I'll mark that spot. And then I'm going to measure. And that is about 3 centimeters. And 3 to 5 is normal diaphragmatic excursion. And you're right in that normal range. Okay, so you can turn around. All right. And next I'm going to check is vocal resonance. So I'm going to have you repeat 99 and I'm going to listen with my stethoscope. So every time I put my stethoscope on you, say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
And vocal resonance is intact. It was muffled as to be expected, and it got more muffled and decreased as I got lower. Okay, so now we're gonna move on to inspection of the heart. Let me move all this stuff out of the way. So for the heart, I'm gonna start with inspecting and just looking at actually I'm gonna have you scooch back and lay back for me. There you go. Oh, you can get on the pillow. There you go. So I'm gonna start with palpating your apex, your sternal borders, and your sternum. So let me find my landmarks here. That's your suprasternal notch, your angle of Louis. The apex of the heart is on the left side, mid-clavicular line down. I'm going to palpate, see if I can feel it. And then I'm going to Feel your sternum. Sternum is there. And then your sternal borders. Also feel those. Palpate those. Then I'm also going to, as I'm palpating your apical pulse, I'm feeling for any heaves, pulls, lifts, or thrills. I'm also going to check your aortic, checking for any heaves, lifts, pulls, or thrills. Okay. And there's another position I can check your apical pulse, and I'm going to have you roll to the left side. And I'm just going to put my hand there. And this just brings your heart closer to the chest. And the apical pulse is also known as the PMI, point of maximal impulse. Okay, go ahead and roll back. All right, so now I'm going to check your heart sounds. There are 5 part sounds. I'm going to find your sternal border again, your sternum, and I'm going to come down to the second clavicular line, or second intercostal space, and I'm going to listen to the aortic heart sound. It's on the right side, second intercostal space. Pulmonic is on the left side, second intercostal space. And that's where you hear S2 at. I can hear S1 and S2, but you can hear S2 the loudest. On the left side, I'm going to go down to the third intercostal space, which is first point. The fourth intercostal space is the tricuspid valve on the left side. Or the fourth intercostal, yeah. And the fifth intercostal space is the mitral valve, and that is mid-clavicular line. I'm listening for the apical pulse. This is where you hear the S1 sound the loudest. And that's that PMI again. Okay, so now I'm going to check for murmurs in all 5 of those locations. So aortic, pulmonic, first point, tricuspid, mitral valve. I didn't hear any murmurs or bruits. I didn't hear any abnormal heart sounds like S3 or S4 or any splitting noted. Now I'm going to check your abdomen. I'm just going to lift your shirt midway. And pull your hands down. I'm just going to note your abdomen, that it's flat. I'm noting the contour. It's evenly shaped. Color is symmetrical all over. Ribs are proportionate on each side. I don't see any like bulges or masses, no abdominal distension. I'm having you lift your head off the couch a little bit. And when you do that, your muscles tend to contract. I'm looking for any like herniations or masses or bulges that pop up. And I don't see any, so you can go ahead and relax. This part now, I'm going to auscultate your vowel sounds. I'm going to listen to all 4 quadrants. I'm going to start with the right lower quadrant first. Using my diaphragm. Right upper quadrant. Left upper quadrant. Vowel sounds are present. Left lower quadrant. I do hear vowel sounds in all 4 quadrants. Now I'm going to assess for bruits before I do my percussion part, so I'm going to get that out of the way. So I'm going to use the bell of my stethoscope, and I'm going to listen in. I'm checking for any bruits. I'm listening in the epigastric area. Or the aortic area, epigastric area. I'm also going to assess the renal and iliac arteries, checking for any bruise. Then I've also assessed the femoral arteries, but for privacy's sakes, I'm gonna assess the femoral arteries. All right, so now I'm gonna palpate or percuss rather, and I'm listening for tympany or dullness. So I'm gonna palpate in all four quadrants. I'm gonna start at the right lower. Right upper or left upper. Work my way down to the left lower. Okay. Next I'm gonna do is palpation. I'm gonna do light palpation. Light palpation, I'm checking for any tenderness, any masses. So you let me know if this is too hard. I'm starting the right lower quadrant. That's from right upper quadrant, epigastric area, left upper quadrant, left lower quadrant. And I don't feel any masses. There's no tenderness. Any tenderness when I do that?
No.
Okay, so now I'm going to do some deep palpation, and I'm checking for deeper to see if there's any masses or nodules or anything like that. Okay, and I didn't feel any masses. Now I'm gonna check and see if I can feel the edge of your liver. Your liver is on your right side, so I'm gonna have you drop your arm, place my left hand under your back, and I'm gonna find your 11th and 12th rib and put my hand there for support. My right hand, I'm gonna feel under your lower left rib. I'm just trying to feel the edge of your border of your liver. Sorry. Okay, now I'm gonna do the other side, and I'm gonna try to feel your spleen on that side. So just relax for me. Okay. All right, so I'm gonna have you sit up for me. I'm just gonna palpate your back and your coastal vertebral area. And this is checking for like if you have any kidney issues, and you tell me if you have any pain here. Any pain?
No.
Any pain? Pain? Okay. So you have any kidney issues. So now I'm gonna do your excuse me, I'm gonna assess your blood vessels. So what I'm gonna do is check all your pulses. I'm gonna start with your carotid. I can feel that, and we never assess both carotids at the same time because you can include blood flow. And I can feel that. I'm gonna assess your temporal, your brachioradialis, and then I'm gonna check your radial. Make sure they're equal bilaterally. And then I'm gonna check your popliteal. Sometimes the popliteal is hard. Just relax your leg. It's hard to feel, but it's behind your knee. Oh, there it is. Okay, and we'll check it on this side. Okay, and then I'm gonna check your dorsalis pedal pulse, and I can feel those bilaterally on both feet. And I'm gonna check your posterior tibial. Yep. And you already noted that you have good color all over. You have equal hair distribution on both legs, and I can see it on your toes. You have good color, and your capillary refill was less than 2 in your toes. Okay. So now we're gonna do your cranial nerves. So we already did cranial nerve 1, which is your olfactory nerve, and that was your smell test. Cranial nerves 2, we also assessed as well when we did your Snellen chart and your Perla. And you also did the 6 cardinal gaze. That assessed for cranial nerves 3, 4, and 6. Cranial nerves 5 is your trigeminal nerve. I'm gonna have you clench your jawline and don't let me move it. Okay, yeah, your jawline is strong, so I couldn't move it. So your trigeminal nerve is intact. Cranial nerve 7 is your facial nerve. So I'm gonna have you do a couple of facial expressions for me. I'm gonna have you do a mad face, sad face, happy face, big smile, surprise, open your eyes real wide. Yes. And then what else? Puff your cheeks out. Good. Okay. So that's cranial nerves 5 or 7. They're all intact. Cranial nerve 8. We also already did that with the whisper test, and your hearing test was intact. So cranial nerve 10. I'm not going to do that. That's your gag reflex because I know you have a really bad gag reflex, so we're not going to assess that. So cranial nerves 9 and 10 and 12. I'm going to assess. I'm going to have you say stick your tongue out. Your uvula is midline. It moved up and it's midline. Now, tongue is, I'm going to notice the shape. It's symmetrical. Go side to side for me. She can move it side to side. There's no ulcerations on it. Cranial nerve 11. This is your spinal accessory muscles. I'm going to have you turn your head to right to left. Make sure there's no pain. And then shrug your shoulders up and down. Okay, good. Your spinal nerves are intact. So that was all your cranial nerve. Now I'm going to test your balance and coordination. So I'm going to move this out. We're going to have you do a couple of standing tests. Before we stand, let's do our coordination test. I'm going to have you put your heel and run it down your shin on both legs. So do one at a time. Good. Run it down your other one. Perfect. And then I'm going to have you follow my finger, but I want you to point, touch my finger and then touch your nose. Touch your nose. Okay, so your coordination is intact. Now we're going to test your balance using the Romberger test. So I'm going to have you stand straight up for me. You can come right here. And then I'll have you close your eyes. Any dizziness? No. Or lightheadedness? Okay, and your balance is good. Okay. So I'm going to have you, now we're going to test your gait, see how you walk. So I'm going to have you start back there. And you're just going to walk forward normal. Okay. Then when you walk back, I want you to walk on your tiptoes. Okay, good. Now walk back. I want you to walk on your heels. Okay, and then turn around. You're going to walk back. You're going to walk heel to toe. Okay, good. Keep going. Okay, you can stop right there. All right, so I'm going to test you. I'm going to have you sit back down. We're going to do some test your sensation now. Get a couple of things. So I'm going to have you, all of the sensation part, you're going to close your eyes and you're going to tell me whether you can feel me touching you with these things and whether they're soft or painful, okay? Okay. So every time you feel something touch you, close your eyes. Every time you feel something touch you, I want you to tell me now.
No. 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 No.
Okay, keep your eyes closed. Now I want you to tell me if it's sharp pain that you feel.
Sharp. 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 Dull. Sharp. Dull. Dull.
Okay. Now open your hand for me. I'm going to place an object in your hand and you tell me what that is.
Paperclip.
Okay, good. Now I'm going to keep your hand open. Take your hand. I'm going to write a letter in your hand. I want you to tell me what that letter is.
T.
Yes. Um, the next thing I'm going to do is it's called a 2 point 2 point diversion test, and you can tell me whether you feel if you're being poked in 2 spots or 1 spot.
2. 1. 2. 1. 2. 2. 1.
Okay. All right. Now keep your eyes closed. Last one. I want you to identify the body part that I'm going to touch.
Forehead. Arm. Forearm. Hand. Knee. Foot.
Okay. Great. Next I'm going to do, keep your eyes closed, and this is the last one. I'm going to move your finger up and down. I want you to tell me which direction I'm moving it in.
Up. Up. Down. Up. Down. Down.
Okay, good. All right, now I'm going to check your reflexes. So the first one, yeah, I'm having you scooch back. The first reflex I'm going to test is your plantar reflex. And this is on the bottom of your feet. When I do this, I'm checking for the Babinski response. And I'm going to start on the outside of your foot. Yes, her Babinski response is negative because, as you saw, her feet did curl in, flex in. Yes. Okay. Now I'm going to check your reflexes, your deep tendon reflex. I'm going to check your tricep reflex. So yeah, just relax your arm. Your reflexes are deep. Okay, and we've seen her arm move in just a little bit there. Okay. Now I'm going to check your brachial radialis. So I'm going to have you try to flex your arm for me. There, I found that brachial muscle. Now relax it. And we see her hand jump a little bit. Now I'm going to check your patellar reflex. There we go. Gotta hit you kind of hard to get your reflexes. Check that one. Fairly good. Your Achilles. I'm gonna check that one. So just relax. Let me hold your foot. Okay. And then I'm gonna check your feet for ankle for clonus. So I'm gonna rotate and then push your foot up. And that ankle was negative, and so was that one negative for clonus. Okay, so now the last part of my exam is going to be your musculoskeletal system. So I'm going to have you stand here in front of the screen. First I'm going to do is just take a look at your musculoskeletal system. Look at your frame, make sure it's even, it's erect, have good posture. I'm also going to be looking at your spine, making sure there's no kyphosis or lordosis. Your arms are symmetrical bilaterally. Legs are symmetrical bilaterally. Your shoulder blades and scapula are symmetrical bilaterally. Then I'm going to have you I'll palpate all your joints. Make sure there's no tenderness or swelling. You don't have any pain when I do that?
No.
Okay. Checking for tenderness or swelling in your fingers. Making sure there's no nodules. No pain in your hand.
No.
No joint pain in your knee. How about your ankle?
No.
Okay. And there's no swelling in your feet with you standing. I didn't feel any swelling or crepitus or anything like that. No masses or nodules. Um, Now I'm going to check your range of motion. So I'm gonna have you just hold your arms straight out, do arm circles for me. Good. Now go backwards. Good. Elbows out and in. Arms straight out, over, front and back. Good. Range of motion is good there. So hold your arms straight out. Don't let me push them down. Good. And don't let me push down. Perfect. With your legs, I'm gonna check your range of motion. So I'm gonna have you extend one leg in front of you. Now do your other one. Okay, now extend one leg back behind you. Now do your other one. Okay, now I'm gonna have you step out a little bit because I want you to do side to side. Perfect. Checking your range of motion in your hips. And then I'm gonna have you squat down and stand back up. Checking your range of motion in your knees. Good. Fingers, are you able to open and close them like this? Wrists, rotate them in and out. Okay, good. I'm gonna have you sit down. We're gonna check your strength in your legs. So I'm gonna press on your legs and you try to lift them up. Good. Okay. Extend your legs, one of your legs out. Don't let me push it down. Good. Push down. Good. Other one, push up. Push down. Good. Okay. Now hold your legs out again. Rotate your feet, ankles. No pain or anything when you do that?
Yeah.
Okay. Put them down. Point your toes up. Good. Point your feet down. Good. Your muscles are intact. You also have good muscle tone. I'm going to check your, you did your elbows, legs, feet, and ankles. Do your shoulders lift up. Okay, good. And your jawbone again. I tested your temporal mandibular earlier, but I'm having you open, close, move side to side. Okay, just clench your jaw. Don't let me move it. Okay, strong. Okay. I think that's it. That kind of concludes our head to toe assessment. Do you have any questions?
No.
Thank you.